Today we're going to look at health promotion, and this first slide says it all. It says how this doctor is talking to different groups of people and engaging them in health promotion. So this whole presentation is going to talk about the different models. Let's dive into it. So before we go deep, what's health promotion? Like, why do we need to promote health? So it's health promotion is an initiative that includes education, policies, and environmental change to enable people, community, and the population to improve their health and well-being. So the focus is improving health, preventing occurrences of different things that can lead to bad health. So we're going to look at how to promote this, how to get to the community at large, the whole population. So it's not just to a certain group of people, but the whole community, the whole population at large. So the objective of this presentation is to look at how we can prevent, or how we can improve, prevent, and control diseases and alleviate health gaps. So this presentation scope is going to focus on the current health promotion models, one specific health promotion initiative, and a chosen organization impact on the society. That's what we're going to look at now. So let's look at, so first of all, we're going to look at a current promotion model. So the promotion models we're going to be looking at is the HBM, which is the health belief model, and the ecological model. First, let's look at the HBM model. It says this model targets behavioral change by enlightening perceived dangers, benefits, obstacles, and providing action clues. An example is smoking cessation. So we're going to look at the keywords it says here: perceived dangers, benefits, obstacles, improving action clues. So this is what this model is focused on, while the ecological model focuses on it's the model that targets health concerns from varying levels, ranging from intrapersonal, interpersonal, community organizations, and policies. And it also focuses on the relationship between people, the environment the environment that is influencing these health issues. And an example is the smoke-free laws. So this is another model. This model is the health promotion model by Nola J. Pender, and this one targets the enabling people to achieve optimal health while focusing on the individual's characteristics, behavior specific cognitive and behavioral outcome. An example is teaching an individual stress management techniques. So this model, we can see from the HBM, the ecological, and this model, they all have different ways they promote health. And the last one is the stage of change model. This model is also known as the theoretical model, perceives behavioral change from the lens of process through specific stages, and the stages are the pre-contemplation, contemplation, preparation, action, maintenance, and relapse. An example is obesity campaign. So we have seen that we've looked at 4 different current models, and we have seen that all these models, they all have different ways in which they promote health. No single model is the same with another. They all have the different goals, different areas they target, and different ways in which they target these concerns, and different ways which they are able to promote these concerns. So we're going to be comparing the ecological model and the HBM model. So the both models, this focus on we're going to look at what the model focuses on. We're going to look at the strengths of both models. We're going to look at the weaknesses of both models, and we're going to look at the suitable applied in both models. So if we look at the ecological model and the HBM, ecological model focuses on the intrapersonal, interpersonal, community, organization, and policy levels, while the HBM focuses on person perception and decision. So you can see that the HBM focuses more on an individual, while the ecological talks about not just the individual but almost the whole population, the community at large. That's why it says intrapersonal, interpersonal, community, organization. So it's not about an individual, but it's about the community at large. So the strengths of both models. The ecological tackles systematical factors, considers multiple influences level, emphasizes on environmental influence, because if you look at what it focuses on, it doesn't just focus on the individual, it focuses on the community. And the community, when you're talking about community, you talk about the environment, what is going on in that environment that can influence this behavior, or that is causing these health concerns. While the HBM emphasizes on individuals' belief in influencing health behaviors, because some of us have health issues that we just believe maybe is inherited, or is believed to say, oh, because I'm in this certain situation, that's why I'm having this, or because a certain thing is happening at this certain time, that's why it's happening. So HBM focuses more on the individual. So, and it's easy to understand, clear framework, implementable, or effects for targeted behavior. So because it's focusing on that individual, they look at the individual, they look at the behaviors, and they target it. That's the HBM. So but both models have weakness. And so for the ecological, the weakness on it is the implementation, evaluation challenges. That's we have on the ecological one. The sustainability challenge, because it covers more than just the individual. So to sustain it, if you start this promotion here, the sustainability was one of the weakness of this model. Measuring outcome, over reliance on environmental influence, because it focuses on more communities. So they believe that the environmental factor was the main cause of why people have certain habits, or why people have certain illness. That is why it's a weakness, because its health issues are more than our environment. While the HBM was over reliance on the individual's belief, because now if you're focusing on the individual, it's what the individual says you're going to believe. You're not relating it to any other factors. So that's the weakness of the HBM. And another weakness is narrow predictive power, limited applicability. Yes, and reductionism of complex health behaviors. So because the HBM focuses on the individual at the start of the health promotion, we're going to focus on the individual, focus on what the individual tells us and say. But along the line, if the individual has more than one health issues, I'll have a complex issues. Now that becomes a challenge, because the model was to target one single issue, but along the line, when you start having conversations with this individual, there are complex issues, and that's where there's a weakness. And we have the suitably applied in. So it's ecological model is suitably applied in the public health campaigns. For example, the smoking cessation, while the HBM is clinical setting to educate individuals. So is a one-on-one. You have to go into it could be a local community where they say you can come in for free BP checks, or come in for free health checks, but you need to go to a certain environment to be able to get this done. So we're going to evaluate both models' effectiveness. So the ecological models has its strengths, and we're going to look at the strengths, we're going to look at the limitation. And for the ecological model, we say is most suitable for population level impact, since it utilizes multi-level initiative, because from when we were looking at the strengths and weakness, we saw that it's not just focused on the individual, it focuses more on the community, large populations, and is effective for tackling complex health, provides dimensional frameworks for understanding the interrelationship between individual and the environmental factors. But its limitation is lies in complexity and high cost of implementation. While the HBM has its ability to address specific health behaviors such as smoking cessation, shape behavior, since its focus is on individual, applies to diverse health issues and population. But its limitation is it over focuses on the individual, like we said earlier, and it downplays the influence of emotions on behaviors. So, when I started the presentation, I said we're going to look at how one organization was able to put this policy into action. So we're going to look at the NHS Stopping Smoking Service. This is the Chosen Health Promotion Initiative. So we're looking at the NHS, and the NHS service is available at hospitals, GP surgeries, pharmacies, and various locations to support individuals. So it's not just restricted to a place. It has various places. Anywhere you find yourself, you can go in and get these services. And its aims and objective, it focuses on to foster smoking cessation. This particular health promotion is to stop smoking and to raise smoking awareness. So yes, we have a lot of smokers, and we're trying to make awareness. NHS is trying to make awareness to people that smoking has a certain effect on your health, and we're going to see how NHS was able to promote this. And the last aim was to improve the quit rate. So, and we have this. These are the goals when NHS set out to promote smoking cessation. These were the goals that set out. This was the promotion. This is the goal. This is what they intend to achieve with the promotion. That's why the aims and objectives. So, and this was how it was designed. And let's put this to the public. Let's see how it's going to affect the public. Let's see if we'll be able to achieve 5% smoking, 5% of smokers, like out of the, let's say 100%, we can, if NHS was planning to achieve 5% to stop smoking. So this is NHS promoting initiatives. So this is it. So it's better health, smoke-free NHS. Very simple banner. So at the end of this promotion, there was a 51 quit rate at 4 weeks. And from 2001 to 2016, an estimated 15% reduction in smoking attributed to the NHS Stop Smoking services. So we're able to say that with this health promotion, this is what it was able to do. They got to the community, the services were provided, it wasn't restricted, and they welcomed a lot of people. There was education in city centers, and local community. In a lot of city centers had a certain station where you can go in and they can encourage you, and we had lots of bus stands in different locations where you can just walk in. It's still in the city center because that's where majority of people go to. So they had a different bus station where people go in and they educate you. They got free samples of patches and other alternatives to help people that smoke quit the smoking, and they were able to achieve all of this because there was so much effort and campaign to reach the community. And it had reduction in premature fertilities, improved health outcomes, saved the NHS cost of millions of pounds yearly since the implementation. And till date, if you go to any city centre across England, you will still find them on certain days. Vans are packed. There are certain city centres that have a specific space for people that can come in to get more information on how to quit smoking. So, but the challenges, despite all this effort, there were still challenges with this. It says, despite the successes, there are still some attendant challenges: high relapse rates, funding barriers, lack of digital accessibility constrained by rural population. So we looked at that, and now we're looking at my organization's contribution to public health achievement. The NHS England has made significant contributions to public health in England. Various initiatives targeting improving health outcomes. Some of these initiative services include the Stop Smoking Services. This program was funded and supported by the NHS England to advise smoking cessation. Like I said earlier, you go to a lot of city centres and there are vans packed for this cause, and there are certain spaces allocated for this cause too. And it has really helped, and it has really reduced smoking, because a lot of people that are willing to quit smoking have access to this, and they're being encouraged and they're being taught how to be able to quit smoking, and there are a lot of alternatives given to them to help them. So these are the achievements. I'll just read the last one. The mental health service. The NHS England supports children and young people with mental health services by providing access to this support system. So at some point, it didn't only restrict to just you smoking, because smoking had a lot of different effects on different people. So they welcomed the mental health service too, and the policy advocates. The NHS England is supporting policies that promote safe health. Some of them are person-centered care, integrated care system, sugar taxes, and smoke-free zones. So these are the achievements the NHS, my organization has been able to, the NHS. So in conclusion, this presentation has discussed the HBM, the ecological, the Pandas health promotion models, and the stages of chain model, with emphasis on ecological and the HBM. And it's also examined the NHS Stop Smoke Free services and and the NHS England's contribution to public health. So after the NHS smoke free services, we also looked at how the NHS has been able to contribute to the public health generally. Previously we talked about mental health, young people. So, and it has done this via initiatives, various initiatives were also presented along with the challenges. To conclude, the public health concern must be tackled with multifaceted health promotion approach for effective results. So we have to use different tactics, different method, different initiative. A lot of one we don't need to focus on is like the both models worked, but if we can implement the both models, because each model has a strength, each model has a weakness, but if we can put all the models together, maybe it will give us a better result. And to conclude, effort must be deployed with digital inclusivity, because as the world keep going, things keep changing, technologies keep advancing, so we need to move with the technology. So we have to consider this, because people living in rural area might not have access to all of this. And adequate funding and collaborative approach in mind. Thank you.